I'm over here at Wells Plastic Surgery and Skincare with Rachel and Susan Wells. How are we today?
Good morning. Thank you for coming.
It's fantastic. What we're doing right now, we're doing a spring demo day.
Absolutely.
And this is starting from 10 till 6
Yes.
over here at your clinic. All the information, as you can see, is up on the screen now. But what Rachel is doing now, we're doing a lip injection.
Yes,
Talk
we
to us a
are.
little bit about that.
We're doing Restylane Silk. Emmy was injected 5 months ago, and we actually enhanced the edge of her lip to give her more structure and made a beautiful Cupid's bow. She's obviously a really healthy young woman, so today the goals are just to add more volume. We've injected this half of her upper lip, and Rachel's now injecting the other half, so I think you can see how she has great structure but just a little more volume on that side.
And this is the look that everyone's wanting now, a much plumper lip without it looking overdone.
Correct. And we spend a lot of time talking to people about what their endpoint is, and they even bring pictures.
And Susan, I wanted to ask you, when you say you're using Restylane, is that correct?
Restylane Silk.
Restylane Silk. How long is that lasting in the lip nowadays?
Well, it depends on your metabolism, some other things, but we really say about 4 or 5 months. It does have a residual effect, so if you will retreat in about 4 or 5 months, you may go longer, even to a year or so.
Okay, so for people at home who haven't had lip injections,
Yes.
what are the do's and don'ts before you come into the clinic to have anything done and post-injection as well?
That's a great question. One of the biggest things we ask you to do are not to take medications or supplements that make you bleed, so you're more likely to bruise. We also ask you not to wear makeup afterwards for 3 hours because we don't want to contaminate the site.
That is perfect. And I was interviewing Dr. Wells in the studio one day, and he said one of the things that he loves to encourage his patients to do is use arnica in
Yes.
before any injection
Yes.
or any surgery.
Yes.
And what's the purpose of that again?
Arnica decreases inflammation and actually helps bruising go away a little faster. If people are really concerned about swelling and looking awkward, we also offer some medications that prevent that.
That's amazing. I want to quickly touch on the demo day today that
Okay.
we're doing over here at the clinic. What is it that people can expect?
Well, every hour we're going to showcase various services in our non-surgical care. We'll have tattooing, we'll have hydrofacials, I'll be doing some Botox and Dysport. She'll be injecting some cheeks and lower face. And it's just a full array of things, including Dr. Wells being here.
And that's one of the best things. You can come over here free of charge today, everyone. Not only do you get discounts on any products or services that you're offering here, but you get to speak to Dr. Wells and talk about any concerns that you might have or any procedures that you would like to have done in the future. Susan Wells is amazing. Rachel Bradford, the team over here at Wells Plastic Surgery and Skincare really do know their stuff. And they've been part of Midday Kentucky, and we've got to know them as part of our family and the things that they do over here at this clinic. If someone's feeling a little bit insecure,
Yes.
and not thinking, I'm too nervous to go in first, what do you say to them right now who just want to jump in the car and say, I want to go and see Susan?
Well, she needs to come over here, or he, actually, and we'll have a quiet little private consultation.
Yeah.
And we'll talk about what their
Because
goals are.
it does intimidate some people because
does.
they think about it. They see everyone like us talking about these procedures, but they do feel insecure and they don't want to be in a room full of people. So what you're saying, Susan, is that you can take people into a little room,
Yes.
have a quiet conversation and put them at rest.
Yes, in fact, Dr. Wells is doing many consultations that are very private in his consultation room.
We love that. Very quickly, I want to ask your opinion. What do you believe is the right age to start doing lip injections?
I think it's the right age if you're over 18
Yeah.
and you desire that.
All right, thank you so much, Susan. We're going to have so much more coming up. And over here at Wells Plastic Surgery and Skincare, I'm joined by Susan Wells. How are you today?
I'm very good, thank you.
And we're talking all about your skin demo days over here.
Yes.
Tell us a little bit about that to begin
So
with.
it's an open house day, and we've changed the format. We'll be doing demonstrations every hour. Our first one is permanent makeup.
And this is what I'm loving. So let's start looking at what permanent makeup is about, the tattooing.
Yes.
And explain that with what we're looking at now.
Okay, so this is Vicki, and she has had her eyebrows filled in because after menopause, many people lose their eyebrows. And what we're doing is a unique lash technique. So instead of just filling it in solid, Bailey, our specialist, is actually creating brush strokes so that it looks more like a real hair.
It looks amazing. Now, is tattooing on the eye and the lip and the eyelid as well similar to doing a tattoo on your arm that what the most common person would think about?
Absolutely, but
yes.
in this environment, it's painless because we have our nurse practitioner, myself, and Dr. Wells who do injectable anesthesia. so that there is no pain involved.
Okay, so just talk us through how it works.
Well, you implant material just like a regular tattoo.
Right.
You come back in 3 or 4 weeks after it's healed for a touch-up, because it doesn't all take, and that's just part of the process and the fees.
Mrs. Wells, when we're doing eyebrows right now, what are some of the other areas that you are doing over here at the clinic?
That's a good question. We also do eyeliner, lips. Vicky's in the middle of having her lip application done. She'll be coming back for another treatment soon. And actually, for breast reconstruction patients, we do nipple areola tattooing.
Amazing, I didn't know that.
Right.
So is this a permanent tattooing like you would see that guys and girls have on their arms?
Yes, but
Okay.
permanent, you need to be cautioned, because with sun exposure and use of different exfoliants and all, it will fade over time just a bit.
I was just about to
Yes.
say, so are we talking come back every year and just let you have a look? Or?
No, I think it's more like 5, 6 years, depends on your sun exposure.
Oh wow, that is amazing. Now, very quickly, if people are coming over here to the demo day and you were talking about, you know, people who might be a little bit nervous coming in, what do you say to them at home?
I say come on in. We'll find a private spot. I will spend time with you if you're more interested in something surgical. Dr. Wells is going to do private consultations in his consultation room.
I think that's amazing. And also we have lots of discounts across the board that are
Yes.
happening over here. Thank you so much. We're going
Sure.
to chat to you again in just a
You're
moment. I'm over here at Wells Plastic Surgery and Skincare with Mrs. Wells. How are you?
I'm very fine.
And I keep doing this, and I know you've got your own mic, just to have
okay.
it. Now, we're talking about our demo day. What's
Yes.
going on over here today?
Today, we're trying to highlight all of our non-surgical services. We have permanent makeup tattooing. We're going to show micropeel here. We're actually going to inject lips.
I
We're doing
love that.
Dysport and lower face.
If you've been watching the show all morning, you've seen us do some of these demonstrations already. So let's talk about the procedure that we're doing here. What is the technical word for this?
This is dermaplaning, and it's a mechanical exfoliation with a blade that actually takes off dead skin and that sort of downy peach fuzz that women absolutely hate.
What's the procedure? Why do we do this?
We do this because you want really smooth skin. It does exfoliate you, so your products can actually, when you're using medical products, they'll penetrate better and your makeup goes on better.
What's the overall benefit long term?
Well, when you do this in conjunction with a chemical peel, like the micropeel that SkinCeuticals developed many years ago, you actually get some collagen stimulation also.
That is amazing. It just looks, now, it doesn't look like there's any pain here. There's
There is
no-
not. Actually, I find it very comforting.
Oh, really?
I do.
Okay, so let's talk to me about how the process works. Talk me through the treatment. When someone comes in and lays down on one of your beds first, tell me about the process.
We cleanse their face, and then Paige, our esthetician, will begin doing segmental exfoliation using the blade, and it just simply removes dead skin and the hairs.
And what's the next step after this?
After that, it's a light chemical peel that she puts on, so it keeps working once you go home. That's where you get your collagen stimulation. And then she ends it with a cryo treatment that calms the skin and is antibacterial. This treatment's been around for 20-some years. It's a real workhorse, and we have found it very, very popular. It's very addictive, actually.
Well, I'm just about to say this is something that I could see myself having done every week. Probably a little bit of an overkill every week. Talk to all the people at home who are saying, this is something that I would like to have done, but how often should I commit to this, and what's the regime?
I would, well, first you stop your retin-A. 4 or 5
Oh.
days ahead, so you're not overly exfoliated. And it's a great thing to do once every 4 to 6 weeks. It's especially nice pre-event, if you have a wedding
Oh,
or
yeah.
something where you just want your makeup to be flawless.
Okay, so when people come in to have this done, you're saying stop your retin-A to begin with.
Yes, for about a
Are
week
you,
ahead.
do you need prescription-based skincare? When I
If
say
you want the very
prescription-based,
best
yes.
results, we couple these procedures with home care that does that.
Okay, this is amazing. How long does the procedure normally take?
Paige, how long does it usually take you?
About an hour.
About an hour. That is amazing. Also, guys, if you want to come over to this free demo day, head over to Wells Plastic Surgery and Skincare. All the information is up on your screen now. Susan, Paige, thank you so much. And thank you to our gorgeous models that we've had here today for our demo day. Katie and Eric, it has been an eye-opener of all the services that are on offer over here at the clinic.